Hello, everyone, and welcome to today's session, Exploring Medicines for People with Kidney Disease and Diabetes. My name is Jill Ladd, and I'm the Associate Director of Professional Engagement at the American Diabetes Association. In 2025, the American Diabetes Association entered into a partnership with the American Kidney Fund, and together, we are seeking to increase educational efforts around diabetes as the leading cause of kidney disease. Today's session is one way we are working together, and I will serve as your moderator. In this session, you'll learn about the latest medicines used to manage kidney disease caused by diabetes and hear from one of our American Kidney Fund ambassadors about his experience taking one of these medicines. Later in the session, we'll have a Q&A with our panelists, so feel free to drop your questions in the chat, and we will try our best to get to your question. Now I'd like to take a minute to introduce you to this session's speakers, Dr. Silas Norman and Robert Buzz Buchanan. Dr. Silas Norman is a transplant nephrologist and clinical professor of medicine. He serves as the Associate Transplant Center Director and the co-medical director of kidney and pancreas transplantation for the University of Michigan Health. Dr. Norman also serves as the medical director of the Transplant Center Ambulatory Care Unit. Dr. Norman received his medical degree from Wayne State University, completed an internal medicine residency at Baylor College of Medicine, and completed his nephrology and transplant nephrology training at the University of Michigan. He also holds a Master of Public Health degree from the University of Michigan and is the immediate past chair of AKF's Board of Trustees. Robert Buzz Buchanan is a third-generation resident of San Diego, California, where he has lived his whole life. He was an orthopedic technician for 30 years and has been retired since 2015. Mr. Buchanan was diagnosed with type 2 diabetes in 1998 and was later diagnosed with stage 3 chronic kidney disease, also known as CKD. He has managed his CKD for over 10 years, keeping it from progressing to kidney failure. Thank you both for being here today. Before we get started, I want to remind you that we will have a Q&A at the end of the session, so feel free to add your questions to the chat throughout today's talk. Now I'm going to pass the floor over to Dr. Norman first to share an overview of the latest medicines to manage kidney disease caused by diabetes. Take it away, Dr. Norman.
Great. Thank you so much. Thank you for that great introduction and the opportunity to spend some time with the group today. Good morning, everybody. For the next 7 to 10 minutes, I'm going to have the pleasure of talking to you a little bit about the new SGLT2 inhibitors and the GLP-1 agonist. We're going to talk a little bit about what some of the benefits of these new medications are, and then we'll talk a bit about how we use these medications in practice to help benefit our patients. So to start, SGLT2 inhibitors, that's a mouthful, but it stands for sodium glucose cotransporter, and 2 because there's more than one. And in our kidneys, you have about 500,000 kidney filters. And after those filters fluid filter waste products, you have a series of pipes pictured in the cartoon to your left here that help manipulate that fluid, manipulate those waste products to hold on to all the things you want to keep, get rid of all the things that you want to get rid of. And right at the start of that filtering process in what we call the proximal tubule is a receptor, this SGLT2 receptor, where you reabsorb some 90% of the glucose that you typically would filter. And so what these medications do when they block that receptor, glucose that you would otherwise reabsorb ends up going out into the urine. And that's one way it can help to lower blood sugars. And so these class of medications were originally developed to treat type 2 diabetes. And then as we find different effects of a lot of medicines, they turned out to also have really protective effects for both the heart and the kidney. And you can identify these medicines usually by the end of their names, which are either gliflozin or flozin medications. Just by way of example, here's a cartoon of the heart, and you can just see by all the arrows there that there's a lot of different benefits that the SGLT2 inhibitors might provide for heart function, including things like decreasing inflammation, decreasing fibrosis or scarring of the heart, decreasing how thick the heart is so it works better, helping the heart to relax more effectively so it works better. And all these activities together, you can see, are really distinct from just lowering your blood sugar. So a lot of great effects, not just for blood sugar, but potentially on your heart as well. Let's look more specifically at what are some of the risks and benefits of these new medications. Well, they're very effective at helping lower your blood sugar. They can help bring that hemoglobin A1C down by about 1%, or your average blood sugar down by about 30. You can experience a little bit of weight loss with these medications. And then importantly, as a kidney physician, these medications seem to be very effective in helping slow down loss of function of kidney in folks who have kidney disease, and decreasing the amount of protein that people have in their urine. And you all will recall that having protein in your urine is both a marker of kidney injury, but also having this protein in your urine can also cause additional damage to your kidney. So these can be kidney protective medicines. These medicines may help lower your blood pressures as well. And then we think about some of the risk, because we know, nothing's free as it comes to medications. So there can be sometimes a transient decrease in your kidney function. Because you're losing all this glucose in the urine and water tends to follow that glucose, you may find that you have to urinate more frequently. Because of all this glucose that's now going into the bladder, people are at some increased risk of kidney infections and urinary tract infections. And then, of course, we want to be cautious about people developing low blood sugars or low blood pressures. So being on an SGLT2 inhibitor may require you to adjust some of your other medications. You can see the commonly available SGLT2 inhibitors listed here. You can see they're all flow-in medications. And then on the next slide, we'll talk about how you might use these medications. You can see from this slide that there's really 4 different main reasons that you would use these flow-in medications, either for blood sugar control, either in folks who have heart failure, with or without having diabetes, in folks who have diabetes and chronic kidney disease, and you can potentially use these just in folks who have chronic kidney disease. You can see that not every medication has each of the 4 indications, but you can see there are some common medications like dapagliflozin that in fact is indicated for each of these 4 conditions. And importantly, if you look at the kidney function requirements, you can use these medications across almost the spectrum of kidney function. So they can be very effective across all levels of kidney function. And then finally, how do we use these medications? Where do they sit in our recommendations? So KDIGO stands for, it's the kidney disease improving global outcomes. And so KDIGO makes a lot of practice recommendations for diagnosis and treatment of the spectrum of chronic kidney disease. And if you look at this figure, you can see the top line for management of chronic kidney disease, as you'd expect, is healthy diet, increasing physical activity, not smoking, and maintaining a healthy weight. But you can see the first line of drug treatment in folks with chronic kidney disease are the SGLT2 inhibitors, and that just speaks to their effectiveness. And actually, if you just look in that left column at the SGLT2 inhibitors and follow the arrow down, right below that, you'll see that in individuals who are on an SGLT2 inhibitor and are not ideally controlled, next up is to think about using a GLP-1 agonist. And so we'll talk about those next. So turning from the SGLT2 inhibitors to the GLP-1 agonist. What are GLP-1 agonists? Well, GLP stands for glucagon-like peptide. And there's a 1 because just like the SGLT2 inhibitors, there's more than one of these receptors. And what do GLPs do? Well, they increase insulin, which helps lower your blood sugar and move glucose into tissues where it can be used for energy. and it reduces glucagon. And glucagon is a molecule that helps increase or raise your blood sugar. You can see by the cartoon on the right that similar to the SGLT2 inhibitors, the GLP-1 medications may have effects not just on the gut, increasing insulin, but potentially have effects on the heart and the liver and the brain and the kidneys. And so there may be a lot of benefits we can gain from these new medications. How do these medications work? As we talked about, these are hormones that stimulate insulin secretion. That helps to lower your blood sugar. The other thing they do is they delay gastric emptying. So they make food move out of your stomach more slowly. That has the effect of making you feel full longer and the effect of having you not absorb glucose quite as quickly. So that may help blunt blood sugar rise. We talked about how it inhibits glucagon production, which wants to raise your blood sugar. The beta cells in the pancreas are the cells in the pancreas that make insulin, and so these medications improve the health of those cells and increase the number of those insulin-producing cells, which can help your blood sugar. And then these medicines appear to act directly on the brain to reduce the sensation of being hungry. And so as a result, you can see weight loss. Some of the studies would suggest as much as 15 or 20% of body weight can be lost. And in most real-world applications, somewhere around 5 to 10% of body weight can be lost, which can be tremendous. You can experience some improvements in blood pressure and in cholesterol as well. If we look a little bit more at some of the benefits of some of these GLP-1 agonists, agonist just means it helps. Decrease weight, that's the biggest thing I think we all appreciate with these new medications. Can again improve your blood sugar control, decrease your cholesterol, can help the heart work better, and importantly, can decrease the risk that people have a heart attack. And if you have a heart attack, it can decrease the amount of damage that may be done by that heart attack. In addition, can help move more of that glucose into the muscles where it can be used for energy. There may be some brain protection from these medications. And these medicines seem to demonstrate an overall decrease in your overall risk of dying. There are some side effects with these medications. Remember, they're slowing down the gut function, so some people experience some nausea and vomiting. Some people experience some diarrhea. There's some risk, usually from dehydration, of some kidney injury, some indigestion. And then there's some people who really should not be on these medications, people who are pregnant, people who have a couple of pretty severe GI diseases, and people who have one of a couple of different cancers should not be on these medications. And then you all have certainly heard of things like the Ozempic face, where people can get some cosmetic effects if they have dramatic weight loss that their skin kind of can't keep up with. The indications for these medications are either diabetes control or weight loss. And you can see that there's a number of different medications. And similar to the SGLT2 inhibitors, what's really important is that you can really use them across the range of kidney function. So these can be really effective for folks for a very long time. And then finally, going back to what does KDIGO say for GLP-1s? Well, we say that the long-acting GLP-1s are recommended in patients who have type 2 diabetes and chronic kidney disease who have not achieved their blood sugar targets despite being on metformin and an SGLT2 inhibitor already. You should think about the choice of the GLP-1s to be guided by agents that ideally have cardiovascular benefits, and you can see a couple listed there. There are some similar medicines that you don't want to use with the GLP-1s. And then importantly, these GLP-1 receptor agonists have been shown to promote intentional weight loss and can really be useful in folks who have this combination of obesity plus diabetes plus chronic kidney disease. Thank you.
Thank you so much, Dr. Norman. I'd like to take a couple of minutes to ask an additional question about the medicines. You did such a great job of talking to us about the benefits as well as some of the side effects. What would be some general recommendations that you have for people to talk with their doctor about these medicines?
Absolutely. So, these medicines are really revolutionary. Before the SGLT2 inhibitors, the so-called RAS blockade, medicines like lisinopril or losartan, really have been shown to be the most effective medicines we had to slow down the progression of chronic kidney disease. These SGLT2 inhibitors seem to be even more effective, which is amazing. So they're really first-line treatment. So I would encourage everybody to talk to their care provider about whether the SGLT2 inhibitors are right for them, and to also discuss with some of the potential side effects, to just think through those so that people have good expectations as they start these medications.
Thank you. I appreciate that. Um, Dr. Norman, we appreciate that overview of the medicines. And now I'd like to invite Buzz to join me so that he can share his experience with diabetes, kidney disease, and medicines to treat both. And just a reminder that in a few minutes, we will be taking questions from the audience. So if you do have those questions, feel free to drop those in the chat so that we can ask our speakers today. So Buzz, can you start by telling us a little bit about your diagnosis with diabetes and then later kidney disease?
Sure. When back in 1998, I was working, I noticed having some effects. I was urinating frequently. I was having to drink lots of liquids to seem to keep up. And so actually, a nurse at work took my blood sugar, and it was very, very high, and to the point that I had to go in and get my first and only insulin shot to bring down my sugars. And at that point in time, I was diagnosed with type 2 diabetes, and they started me on a medication called glipizide, and to try to treat my blood sugars. And well, as I went through those years of, I ended up switching doctors, and my primary care physician suggested I take one of these new medications. And it was after he had diagnosed that I was starting to have chronic kidney disease from the test that he was kept giving me. So he started me on the Jardiance in 2018. I think, actually, the Jardiance started on 22, but I was diagnosed first with the chronic kidney disease in 18 or 19, which was 10 years later after I'd been diagnosed with the type 2 diabetes. As time went on, the Jardiance helped quite a bit, following up with just the different variation of blood tests, urine tests, and then the GLPs came along, and my primary care physician, he seemed to be keeping up on all the newest medications, and got me on Rybelsus. And since I've been taking the Rybelsus since 23, so it's been 2.5 years, and my numbers have significantly improved over that period of time. So I see a kidney specialist once a year, and it's gotten to the point where she says I probably don't need to see her anymore. So that's a very pleasant situation. Also, I've lost weight, even though I wasn't really had a bad weight problem. I was a little overweight, but now my weight's within what they deem normal limits. So that's about the entire story.
Well, Buzz, we appreciate you sharing your experience with us. And it sounds like these medications, the SGL2 inhibitors and the GLP-1s that you've been on for a little while have really, you've reaped some of those benefits that Dr. Norman talked to us about. So we really appreciate you being open and sharing about your treatment journey with us. A question that I have for you is, what has been the biggest impact that these medicines have had on your overall management of diabetes and kidney disease?
Just keeping my numbers down. I really don't, it hasn't really affected as far as I'm not necessarily a really great diet protector as far as have changed my diet over the years. I've basically been eating the same kind of foods that I would regularly eat, and I don't really haven't changed that much to keep these, I guess, my weight and my blood sugars regular. So I really haven't had to sacrifice what I was doing or radically change any of my dietary habits to probably because of the medications. Otherwise, I'd probably have to be more diligent.
So you mentioned a little earlier that you had lost weight after starting to take some of these medications, which, as Dr. Norman talked about, is one of the side effects. And just wondering, did you notice a decrease in appetite with that? Or, can you explain any other side effects that you maybe had and how you've dealt with those?
Well, especially the Rybelsus makes you not crave, or your appetite is lessened. So you seem, your brain seems like it tells you that you're full. So you might have a full meal in front of you, but only want to eat half of it and it's actually helped quite a bit. Excuse me. It's helped. Sorry.
Oh, feel free to take a drink if you need one.
I will. So both my wife and I now share meals more often if we go out. My voice is starting to give out.
You're fine. We can jump over and ask Dr. Norman some questions that we have started to get here in the chat. And again, if you are just joining us, feel free to type questions into the chat and we will try to get to those questions. Dr. Norman, do people with diabetes and kidney disease often take an SGL2 inhibitor and GLP-1 medicines? And how do those work together? I know you briefly talked about it in your presentation, but would love to have you expand on that a little bit.
Yeah, no, thank you. So, and it's a great question. So, absolutely. So, it's not at all uncommon for people to be both on an SGLT2 and a GLP-1 inhibitor. If you think about it, they're really complementary medicines. So they are helping to lower blood sugar in different ways, and so they, can be used together, both in terms of just getting rid of glucose into the urine is helpful, and then I think, as Buzz mentioned, these effects that the GLP-1s have in making people feel full longer, making them not quite as hungry, can really help people to manage their portion sizes better. And we know that as people lose weight, that both can improve their insulin sensitivity and so can help with their diabetes control. And we know that as people lose weight, that's just less work that the kidneys have to do. So that can also really help in terms of kidney protection because they're not working quite as hard.
Thank you. That's really helpful. And I know I'm excited to see some of the sessions later on today that are focused on nutrition. We did get a question through the chat, and the question is for Dr. Norman, are there any side effects for taking a GLP-1 for an extended period of time?
Yeah, no, so that's a great question. So, one thing we would say is that these medications are relatively new. And so almost certainly we'll learn more about them as the years go on and people have been on them for longer periods of time. Some of the more common things that people have experienced is some indigestion periodically. Some people have some occasional nausea. There are a few people who will experience what we call pancreatitis, or some inflammation of their pancreas associated with these medications, which may require people to either stop these medications, at least temporarily, and then go back and often restart on lower doses to just see what dose or formulation is tolerable to them. It's important that people, their care should be individualized. And so if people have some different GI conditions, it's really important to talk to your doctor about whether or not there'll be, any issues or concerns, with you taking those medications. And then I think we'll learn as time goes on what are some of the longer term impacts if people are on these medications for years, if there are any issues with that at all.
Thank you. Dr. Norman, what are some common questions or worries that you hear from patients about these medications? And, what are some of those responses that you might give? And how would you suggest that a person with diabetes bring that up with their physician or their care team?
No, that's a great question. So, I think broadly speaking, I think all of our patients want to make sure these medications are affordable. So, like any new medication, right? People want to know, is their insurance going to cover it? What's their copay going to look like? And so, we should always have frank discussions about that because we want to set people up for success. And then people want to know about the side effects, right? Because they say, well, you said this medicine is super great, but surely there must be something. And so I think having, clear conversations about some of the potential complications or side effects for folks so that they're also know what to expect and also know what to tell us, if they start to have some of these impacts. And then, how will these work with the medications that they're already on, I think is important for people to understand.
Those are some really good things to consider as patients want to talk to their physicians. So Buzz, I want to switch it over to you. And we have a great question in the chat, and it says, how have you dealt with managing both of your medicines? Any tips that you may have to remember to take those on time or on schedule that you could share with people listening today?
Well, I kind of have a routine for taking my medicines. So the Rybelsus, they recommend that I take that first thing in the morning before I have any food or drink, with just a small amount of water. So I usually take that the first thing I get up. I mean, it's the first thing I do. And then I go about starting my day. And then I'll take my Jardiance after that. So it's a kind of a routine. I have had to use pill boxes at one point in time and I would suggest for people that really need to be organized, the pill boxes work really great. You fill them up on a daily basis and you go about what medications you've taken or maybe you forgot to take because it's either going to be in the box or already gone out of the box. Those have been really helpful, especially when I've been on trips or vacations. I do that. I have a daily packet where I use my pills and separate them out because, of course, being somewhere else, you're not on your daily routine anymore. And that's what I would suggest for people to remind their medications about. That's a good little tip that I do.
I love that. And you're right. When you have your routine, it works great when you're at home. But I really appreciate you sharing about, if and when you're traveling, here are some tips to help people be successful so that they're not forgetting their medications. Thank you for that. Dr. Norman, we have another great question. The question asks, can people with type 1 diabetes take a GLP-1, or is a GLP-1 only for people with type 2 diabetes?
Sure. So primarily for type 2 diabetes, um, um, remember that folks with type 1 diabetes typically are not making insulin. So they're going to need to take exogenous or insulin, either by shots or with an insulin pump. So this is really for folks with type 2 diabetes.
Great, appreciate that. Buzz, another question for you. Have your CKD numbers improved since starting these medications or stayed steady, or have they gotten worse? Can you share us a little bit about your journey with the chronic kidney disease and these medications?
Yeah, since I've been taking the Rybelsus, um, the last two kidney function tests have quite improved quite a bit. Um, I'm if they do a GFR is one of the tests to use my GFR numbers in my last two during the last year have improved to the point where it says I don't have chronic kidney disease. So, the numbers before I was taking the Rybelsus, they were slightly elevating as time went by. And actually, for people that know about those numbers, they actually going down in numbers is a bad thing. Going up in numbers is better. And so my numbers were going slightly down as time went on. But after I started taking the Rybelsus, and now it's been 2 years, um, uh, they're showing that I'm over the threshold, which is on the GFR, it says the number 60. So that has really been a nice thing to see, at least as far as the tests go. My sugars, as far as my A1C, they haven't really improved a whole lot, but they've been very much stable. So taking the Jardiance with the Rybelsus has improved my kidney functions. Um, so hopefully it'll just keep on working that way. Um, the only thing that I wanted to he was talking about your blood pressure. When I was taking the Jardiance, at first I was taking a blood pressure medication. I actually had to stop taking that medication because my blood pressure went down to the point that actually had a little bit too low of a pressure, and we had to stop taking my blood pressure medication. And since that time, my blood pressure is very stable and in good shape. So that's a little information.
Thanks, Buzz. It's very helpful, and I think it's helpful for other people with diabetes and chronic kidney disease to hear that, these medicines can help improve their scores or their numbers when it comes to the chronic kidney disease. And thanks for sharing about that side effect, which, that's really speaks to the importance of having those conversations with your healthcare team. Dr. Norman, we have another question in here. Is it safe to take these medicines in later stages of kidney disease?
Yes. So the short answer is yes. And I think, that's really important to know. Both the SGLT2 inhibitors and the GLP-1s, you're able to take really up until dialysis. We have to make some occasional adjustments, but really They are both safe for, indicated for, and our current guidelines recommend for the appropriate folks to be on these medicines really up until they start dialysis. Which is not true of a lot of medications. So it's actually really exciting to have a medicine that both might slow progression of kidney disease, that you could really use at any stage of kidney disease, is really important, and it's true for both the SGLT2s and the GLP1s.
Any advice that you would have for people who are considering talking to their doctor about these medicines? Any tips or advice that you could share that might help someone in this situation?
Yeah, so I would say, as a practicing physician, I think consistent with what we often talk about at the American Kidney Fund, a well-educated patient can really be the best advocate for their health, and we want to promote that. And as we understand that these are some of the potentially most effective medications out there for folks who have chronic kidney disease, I think having a straightforward conversation, with your physician, with your care provider, if you're not on these medications, I think the question is for your physician is, why am I not on these medications? Because I understand these to be, the first line therapies for my condition. And I think we as physicians like and appreciate, when the patients come to you and say, I'm interested in optimizing my health, here are some options, what are we doing about this? So that we can make sure that we get people on the optimal therapy.
Great advice. Thank you, Dr. Mormon. Buzz, do you have any suggestions for how someone might approach that conversation with their doctor?
Sure. My primary care physician, Dr. Lee, he has always seemed to really stay up on anything new that can help me as a patient. And he also was concerned, and Dr. Salas mentioned the cost of these medications. He was very concerned that I was able to afford the medications, and before he started prescribing them, because unfortunately for a lot of people, these medications are expensive. And luckily for my case, I was able to financially, and with the insurance I have, was able to afford the medications. And I know a lot of people out there aren't able to afford the medications, or they don't have a good insurance plan that helps pay for those. And that's the one thing that needs to probably be addressed with the manufacturers or whoever is dealing with these things. Is these medications are good, but if you can't afford them, they're not very, they're not good for you. I have one friend that he was starting to take one medication, and he said he couldn't afford to take it anymore, so he was going to stop. And that's one of the things that my primary care, Dr. Lee, was making sure that I, never got in that situation. Hopefully people know that they are expensive, and you have to have a good insurance plan to be able to take them and then continue taking them over a long period of time.
Thanks, Buzz. I think it's really important that, you have those honest conversations with your physician and your care team about barriers that you might have, and cost could be one of those. So it's important to bring that up as you are discussing these medicines. I want to thank you both for such an engaging discussion today, and also thank you for all of the great questions from our audience. Before we close out, I do want to take a little bit of time and ask each of you to share one thing that they'd like our audience to know, and then one thing that they'd like our audience to do based on today's session. So, Dr. Norman, let's start with you.
Thank you. One thing to know, These SGLT2 inhibitors are some of the most effective medications that we have for slowing down progression of kidney disease. The last time we had medications this effective came out 30, 40 years ago. So these are very, very effective medicines. And the one thing to do, I would encourage everybody, talk to your physician, your primary care physician or your kidney doctor, to ask if being on one of these medications is right for you, because you may experience substantial benefits from these medications. And so we want to make sure everyone who should be on one is on one.
Great. Thank you again, Dr. Norman. Buzz, let's kick it over to you. What's one thing that you'd like our audience to know and one thing you'd like them to do following this session?
Well, the one thing is also my primary physician, he actually consulted with a kidney doctor that he sent me to also. So it wasn't just my primary care that I consulted with for these medications. Also, I had a kidney specialist, Natalie Swice, that they concurred with diagnosis and treatment together. It wasn't just my primary care physician. He made sure that she, was in agreement with any of the medication changes that I've done over the period of time. And it was more of a team approach. And I think that's a really important thing that they, treated me together. And I wasn't just, again, I'm real fortunate having a good medical plan. More so in San Diego, you have a choice of quite medical plans. I think I was able to probably get one of the better medical plans in our area that keep up with the newest and latest treatments.
Thank you, Buzz. Yeah, that coordination of care is so important. I was listening yesterday to the Kidney Action Week, and someone talked about having to, sometimes you have to be the advocate to encourage, your specialist and your primary care physician to collaborate and coordinate. So thanks for bringing that to the surface today, Buzz. Thank you again to both Dr. Norman and Buzz, and all of you for joining us today. Up next is our Managing CKD Complications Through Nutrition session, which will be at 12 p.m. Eastern Time. During this session, you'll learn about 4 common complications that people with chronic kidney disease might experience and how to manage them. And as we wrap up this session, you will see a brief survey pop up. We would encourage you and appreciate you taking a minute to fill it out and tell us how we did today. Your feedback will be very useful as we plan future sessions. Thank you, everyone, and have a great day.